Doc, I start with you. I heard from several clinicians when the princess first came out of the hospital and the speculation game began, and many believed that this was most likely related to some kind of cancer. Why? What is it hearing about a significant abdominal procedure and the length of time afterwards that is such an indicator to people like you?
Sure. I mean, generally speaking, if a young person undergoes an abdominal surgery, we expect it to be something really simple, like a gallbladder or an appendix, that wouldn't require a long hospital stay and wouldn't really be described as a major surgery. So whenever we use the word a major surgery, especially in somebody that young age, I think, cancer is unfortunately at the top of mind for most folks.
What kinds of cancers can you reasonably rule out, and which are more likely, given what we know?
So obviously, we're all speculating here, and I think, there's certain things we know for sure that it's not. We know it's not a brain cancer. We know it's not a breast cancer. When we look at the abdomen, the most common would be a colon cancer. There's more rare cancers like gallbladder or appendix. There's pancreatic cancer, which certainly would be a much poorer prognosis. But when I look at this too, as a clinician, I wonder whether we're using the word abdomen or pelvis interchangeably, because certainly we've got the female reproductive organs, the ovaries, the uterus, things of that nature. So really, I mean, and even a lymphoma. So it could be really kind of anything. And right now, all we can do is speculate.
Let me ask you one other thing that is absolutely speculation, but I think that we need to use this moment. You keep referring to Kate Middleton as young. She's in her early 40s. She's obviously fit and into wellness, not someone you expect to have this type of systemic disease. And yet, have you heard anything about recent increases in younger people being found and diagnosed with more serious illnesses than in the past?
Absolutely. I mean, first of all, I want to emphasize that I do think she's young because we're the same age, so I want to hold on to that belief. But that
Yes,
being said,
doctor,
we're absolutely seeing an increase in malignancies in younger patients. In fact, I had a patient today in her mid-40s with a new diagnosis of a brain cancer, and her spouse asked me the exact same question you're asking. Why are we seeing such an increase in younger patients with more aggressive cancers? Right now, again, we're speculating, but there's certain things we can look at. Elevated BMIs, sedentary lifestyles, I think neither of which apply to the Princess of Wales. There's a belief potential exposure to microplastics. But right now, we just really don't know. And I think it really just speaks to the importance of screening and making sure that people are getting regular medical checkups, undergoing their cancer screenings, and really being proactive. We're seeing a shift in ages for cancer screening. It used to be we did colonoscopies at age 50. Now we're talking about even as young as age 40 for some folks. So really kind of pushing up our timelines to make sure that we're staying ahead of these things.
Hey, doctor, I appreciate you. Stand by. If there's any questions that pop up, I want to be able to come back to you. And if there's anything that comes to your mind while you hear the rest of the discussion, get in there. Victoria, Rob, thank you for listening, though I'm sure you're curious as well. Victoria, what is your read on why the princess did not offer more detailed information about what specific type of cancer it is?
Chris, truly, I think at this point, any further information is just going to lead to more speculation and armchair experts with absolutely no medical qualifications spouting off on social media about prognoses, types of treatment, and how long she might have left. And I think no one who's going through cancer would want to be subjected to that, but particularly someone who has 3 young children that are in the public eye, that are susceptible to seeing press reports. I do want to say, Chris, and I am not here to stroke your ego, but your take at the start of this segment is one of the very best that I have heard. What we have seen spiral out of control on social media has been nothing short of heinous this week. And I think if she had provided more information, that would have continued. We would have seen any number of people coming out of the woodwork trying to suggest how much longer she had left. And that simply isn't helpful. What I've chosen to take from this statement is that she is having preventative chemotherapy. So much like the King's diagnosis, it looks like they may well have caught this early, and so certainly I'm choosing to remain very optimistic as we move ahead. But I think we as a society, the best we can do is to take a step back and wait for the information, wait until it is presented to us from a reliable, trusted source so that we can really enter into this conversation with all the facts.
Fair points. Rob, I want to bounce to you about what's going to happen in response to this. But, Doc, Victoria brought something up there. The idea of preventative chemo versus needing chemo because it's more of a crisis situation. What is the distinction?
Sure. So, generally speaking, I think what they're referring to when we talk about preventative chemo is the idea that at surgery, likely all of the cancer was removed. So the point of the chemo is to attack any microscopic cells that may have been left behind. At least that's what I infer from the discussion, versus a situation where we've had a cancer that maybe is spread throughout the body and the chemo is there to prolong life as opposed to cure the cancer. So it sounds to me like we're facing hopefully a more curative situation.
Rob, I don't know much about the Royals, but I do, just like everybody else, understand family. And what's an interesting dynamic here is her husband, Prince William, is estranged from his brother Harry. Do you think that this, between the father being sick and now Kate being sick, do you think this will change the dynamic within the family and have Harry come and close ranks, because they're going to need each other right now?
Yeah, you're right. The first thing I would do if I was Harry or Meghan is jump on a plane and get back to Britain. That is not going to happen. My insiders tell me that Harry and Meghan did not even know about this. They were kept out of the loop. In fact, they were not even given the heads up. They found out about this news the same way the rest of us did, by watching TV at 2 p.m. Eastern Standard Time. And that's because they don't trust Harry. And after the Oprah interview and the book, I don't know if I see any way back to what it was before. I hope they can be friends again, but I think this bond might be broken permanently.
Hey, thank you for watching. Please go to newsnationnow.com, newsnationnow.com, and you can find NewsNation on your television provider. And don't forget to click the red subscribe button down below. Then you will get more of NewsNation's fact-driven coverage.